Michigan.
Mr. Speaker, I would yield myself 3 minutes.
The gentleman's recognized.
Mr. Speaker, this legislation brings us a step closer to providing more help to children with unmet health needs, especially those with rare pediatric and genetic diseases. According to the National Institute of Health, the NIH, there are 6,800 rare diseases, and most of these conditions have no treatment or cure, and they primarily affect children. I would guess that everyone in this chamber is personally aware of the devastating impact of these diseases with some family that they would know. I myself have spent some time with a family from my district whose children have spinal muscular atrophy, SMA. It is a very rare pediatric disease that is the leading genetic cause of death in infants and toddlers. And these are great kids. I've got a picture of them, one of them here. When they came to see me, they told me that their name was Cinderella and Sleeping Beauty. And they really are. These are just really marvelous children. They're great kids, and they're a source of real sadness that their disease is at a time that's often incurable and often untreatable. But the barriers to research on rare and genetic diseases are those that are common to most research. It's already difficult to initiate the experimental and lengthy research needed to find treatments and cures. However, when the population of patients is so small, maybe only a couple dozen in a state, these problems are even more difficult to solve. So this legislation is going to help us establish pediatric research networks and a consortia that are a proven way to overcome those gaps in research. Networks and consortia will be comprised of leading institutions that act as partners to consolidate and coordinate research efforts. It promotes efficiency and collaboration, especially when a disease affects just a small number of children. So, Mr. Speaker, I would urge all my colleagues to support this bipartisan legislation. I look forward to a strong vote tonight and working with our colleagues in the Senate to make sure that this bill really does get to the President's desk and makes a difference for families that are really in search of something that will help them with their kids. I reserve the balance of my time.
Gentleman from Michigan reserves the balance of his time.
Mr. Upton, 3 minutes.
Gentleman from Michigan is recognized for 3 minutes.
Well, thank you, Mr. Speaker. This legislation, H.R. 733, the Recalcitrant Cancer Research Act of 2012, will indeed take important steps to improve outcomes for cancer patients. For the many Americans who have been diagnosed with a hard-to-treat cancer, hope is not easy to come by. These patients have heard all about the advances in cancer treatments and cures, but are left to wonder why there isn't some help for them. Unfortunately, their cancers do not respond to the traditional treatments, and as a result, they've had very few improvements in prevention, diagnosis, and treatment in decades. Pancreatic cancer. According to the NIH, it is estimated that 44,000 men and women will be diagnosed with this cancer in this year, of which 35,000 will die. The 5-year survival rate is less than 6% compared to other cancers with survival rates of over 90%. This bill will guide efforts at the National Cancer Institute in identifying a scientific framework that will outline those unanswered medical and scientific questions that will help to focus research efforts for those deadly cancers. Ensuring the availability of qualified researchers and important research resources, such as patient registries, will move the process forward. Tonight, we work to provide patients and their families a little more hope. This bipartisan legislation is an important step as we continue to see breakthrough advances in cancer research, particularly for those cancers whose survival rates remain low and treatment options are limited. I want to thank Chairman Waxman and his staff, as well as Chairman Harkin and Ranking Member Enzi of the Senate Committee, which passed the Senate version of this bill today in committee, enabling us to on the verge of really getting this legislation into law, which is one of the reasons why we bypassed the full committee. And we were delighted to pass this legislation last week in subcommittee, and I singled out particularly my friend Anna Eshoo and Leonard Lance for their stalwart work on moving this legislation, and I got to tell you, the many times we met and chatted about this legislation, I was given an update of the number of bipartisan co-sponsors from 233 to 240 and now 290 some that are there. It is indeed a bipartisan piece of legislation. And one of the reasons why we bypassed the full committee this week in markup, which began actually this afternoon, we'll finish tomorrow, is we wanted to get this bill to the floor right away so that we don't even have to wait for a lame duck session to get it signed into law. So I would hope that my Senate colleagues move this quickly. But I just really want to thank my friend Anna and Eshu and Leonard for their great work. The staff that put this together, I'll tell you, and sitting down with the NIH folks 2 weeks ago, and we've really expanded, we broadened this to include more than just pancreatic, how this started. We have the stakeholders now on board that are excited about this legislation and what it will hold. The private sector out there, and man, we've sure heard from them over the last year or so, but I know too that they are very happy with the passage of this tonight. It's a dream that's come true, thanks to you. I yield back my time to the chairman of the Health Committee, Subcommittee, Mr. Pitts.
Gentleman from Michigan yields back. Gentlelady from California.